I really felt that palliative care really saw me as not the patient, just the patient. It saw me as a mom, as the executive director of a nonprofit, as a productive member of society, and that it was as important for them to get me back out there as it was for me, that they realized they were able to see my goals and were able to help me obtain them.
Yes, yes. Well,
So,
I mean, and what you just said, your goals, that is what palliative care wants to do. We want to help people live well the way they want to live well. And, you know, it turns out that the word goals for a lot of people is a little confusing. And actually, I've met a number of patients who are a little afraid. They're almost hesitant to set goals because they're so worried about being disappointed if they can't reach their goals, right? But what you are saying in the sense of, here's the direction we want to go. We want to get you back to as much as your regular life as we can. And, you know, we know that that'll take a lot of adaptation and a lot of work, but, you know, basically you are capable, right?
Absolutely.
That's a really important message, right? That looking at you today, I would have never guessed that there was a time when you went home, you know, with hair and like all this stuff after a cancer, you know, after just finishing that kind of cancer treatment, which is honestly, being an oncologist, I know it is super intense, but it's super exciting.
And thank you. I'm only 3.5 years out. So I attribute it all to the team and to the family support and to the fact that so much of my treatment was focused on educating the people who were helping take care of me. Yes. And that all stems from the palliative care arm of my treatment, because without them being knowledgeable of what was going on with me, we would have hit a lot more roadblocks going down. And them always being accessible and having answers. And if they didn't have the answers, having the ability to say to me, well, we don't know, but we're going to find that out for you, was huge. I always say that the oncology part of my treatment was the catalyst to me feeling better. The palliative care arm of my treatment was the part of my treatment that got me back to me. Yeah. You know, so I don't wake up every morning and think, well, I mean, took some thought training, but not to open your eyes and say, oh my God, I'm sick. I'm not sick. Today, I am not sick.
Today, I'm going to live my life. Yeah. I love that. And, you know, Rae Anne, I'm just wondering if you would mind saying one of the ways in which one of your kids like learned as they were going through, because I think one of the things I see is there's so many, you know, just things that family members or people who matter, that they just need to learn about how to be supportive and how to be the best, you know, kid or spouse or friend or work colleague. Like, what do you think? Is there something about something one of your kids learned that you wouldn't mind sharing with me?
I think what was best is when we had our first family session, the doctor said to them, you are absolutely allowed to be afraid. And that broke down every barrier, every wall, because we had just gone through this really intense treatment. I remember starting treatment, they said, listen, we think we might be able to cure you, but we're going to hit you with a Mack truck going 100 miles an hour. What does that mean? And especially when your two kids are sitting in, I mean, as the patient who's desperate to cure, you're like, okay, hit me with a truck. I don't care.
Yeah. Okay. Well, I just got hit by a Mack truck, and now you're going to say you're going to hit me with another Mack truck. I think we need to do a little work on the metaphors there with these doctors, Rae Anne. I'm sorry, but go ahead.
So them allowing to be afraid in that treatment, in that appointment, and allowing them to ask questions and allowing them to ask all the questions, and then redirecting them to what it really looks like.
Yes.
And, you know, showing them what the feeding tube does and really giving them the tools to problem solve without it becoming a crisis.
Yes.
I think, so back to your question, it would really be the knowledge. They gave them the knowledge of what was happening, unsugar-coated, but in a way that was manageable.
Right. See, I think that's what you're just saying there is so important. It was talking to them in a way that they could manage it, and then giving the really important information about what to expect and how they can help you. And of course, that would make them feel like a little better if they felt like, wow, I know what to do. I can be helpful here. I'm not just going to sit in the corner and vibrate.
Exactly.
Right.
Exactly. And the fact that we were bringing home some really serious medications that they were hearing on the news and in school, and
Oh God.
we're getting fentanyl, we're getting oxy, a plethora of medication that were all deemed really dangerous.
Yes.
And now every 3 days you're going to be asked to put a patch on your mom's back.
Right.
So giving them that, something that they couldn't touch, they had to wear gloves. Like, what did that look like?
Right. And they're like, oh, this is so dangerous. I have to wear gloves, and I'm putting it right on my mother's body. Right.
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 And then being able to answer the questions, is your mom using the bathroom? Like, really? Like a 22-year-old?
Like a 22-year-old. Yeah. Oh my God. See, I think if a doctor had answered me that, I would have just totally blanked. What 20-year-old wants to talk about that, right?
Exactly.
Look.
Exactly.
But it sounds like they have come through really pretty in a good place. Or how are they doing now?
They're doing really well. I think the significance of being able to forecast long term. We just got a puppy. So anybody who's had a really serious illness, to look 12 years down the road, a dog is a 12 to 13-year commitment. Yeah. That was huge for our family, because we were at one point we were minute by hour, then little by little, day by day, month by month. And to be able to look together as a unit a couple of years down the road.
Congratulations. So tell me, what kind of a puppy did you get, and what's the puppy's name?
Well, the puppy's name is Shep, and he is a 15-week-old Wheaten Terrier.
Okay.
And he is just everything we needed. I mean, not to mention now, they're 26 now, and they're back living at home because of the pandemic. So now you're 26 living with your mother. Like, it just keeps getting worse for them.
Yeah, right. That's hard. Like, that's probably not what they were expecting.
Yeah.
A couple of years ago. Right.
So they're doing fine. They're great.
Wonderful. Would you mind saying one of the ways in which they are different, and one of the ways in which they've changed for the better?
They are much more aware of other people and what other people are going through. Their ability to be empathetic and have sympathy, where, at 20, they're 26 now, 26, they're starting to, have friends who are losing grandparents and, unfortunately the occasional parent. And I think they're much better at dealing with offering their friends support. Yeah. Rather than, being more shell-shocked by it. They become much more empathetic.
Yeah. And able to really deal with those tough emotions, right? And kind of be with people and not just, withdraw or run away.
Right.
I mean, that's such an important lesson, right? Like, that is what our world needs, right?
And they're much more present. More present.
Wow.
So
that is wonderful.
It's nice. Yeah.
Well, congratulations.
Well, thank you. And thank you for all the good work that you're doing and all the healthcare professionals that you're training. I can tell you firsthand as a patient, it's so important how we receive the news and how we're able to digest it with help.
Yeah. Well, thank you. I mean, one of the things I would just like people to know is that they don't have to choose between a healthcare provider, a doctor or nurse who is really good technically or really nice. Like, that's the myth out there. Like, it has to be that they're really good and then have terrible bedside manner, or they're just really nice and they just aren't good at what they do. And you know what? These days, that is not true. And I think people should say, I am not going to settle for somebody who doesn't explain how things are going to really work, or doesn't have access to a team like a palliative care team who can help me live my life through this. Like, I want to reset the bar for everybody in terms of what they ask for and what they expect. Because, we can do it, right?
Absolutely. Yeah. Well,
Can
thank you
I
for your
ask you, can I ask you one
anything.
more question? Yeah. So here's
Anything.
my question. So I talk to a lot of people who are dealing with a serious illness or, are just normal people, and are worried that they could get a serious illness. And I feel like those two groups are really different. Like once you've been through a serious illness or someone you are really close to has been through it, it's like you have a whole different orientation. And I was just wondering if you have advice for me about how we should be talking to the people who are like just the normal people these days. What's your thought about that, Rae Anne?
I would, in a soft way, I would remind people that whether it's you or someone you love is eventually going to be faced with something. But there is a full support of a team that's located at the hospital or treatment center that they'll be at, who can get them through it. That it is not necessarily the end all of everything. Receiving news like that,
Yeah.
and that what we have right now in our health is just it's just such a privilege, and it should be so protected, and you should take care of yourself and your body every day, because it's just, I feel like everybody is just you're just one bad day away from some really devastating news.
Yeah. Well, and I think, thank you for that. And I think that's great advice, because I think especially in this age of COVID, like you can be really close to dealing with a serious illness. And I wish there was this openness to, how are we really going to get through this? And I wish there were more stories out there in the world about how do people who get COVID also make it through the illness and deal with it and go on to live their lives. And I feel like that kind of wisdom is not so much out in the media, and I wish it were. I wish there were more of it. There's so many scary stories, and yet I feel like the scary stories have gotten to a point where they just want to make everyone feel like I don't even want to think about that.
Right.
Instead of, this is an opportunity for all of us to figure out, like, what do I need to know if I ever face this? So
I think you just need to know that most communities have really great access to some fantastic doctors.
yes.
Hopefully, with these videos and with the work that we're doing together, this will branch out into more areas. The excellent care that I received should not be defined because I live 60 miles from Manhattan. So hopefully, work is being done to get this to everybody.
Yes. Well, that's what we're doing here. I mean, the message of that you can get the kind of care that will help you live and have quality of life throughout your illness, that you can have a say in your care, that the people around you can actually learn and get support to deal with the illness. I mean, I think those are such important messages. So thank you.
Funny when you, oh, you're welcome. It's funny when you mentioned during this time of COVID.
Yeah.
And to me, it's very reminiscent of that time after treatment.
Oh, really?
Really not knowing when it's going to end, not knowing if you're going to be sick,
that's right.
not know. It's very reminiscent of that waiting period and how it's
like
very reminiscent of it.
The uncertain, you mean, like, and what I'm thinking, the word that came to mind for me as you were talking was uncertainty. Like, you're like,
Absolutely.
When is this? How long is this going to be? So, just because I bet lots of people are thinking about this, like, what have you learned from dealing with your cancer that you could share with everybody who's worried about COVID?
I have learned that right here and right now is probably the most important place to be, because it's all we have. Yes. And that you can take best practices, that we are being told what will hopefully keep us better. You wear your mask, you social distance when you can, you wash your hands, and you just be aware. Yeah. Be aware of how you're feeling, and if you're not feeling well, you stay home, and just listen to your body.
Yeah. Your advice that there are lots of little steps you can take, but then they add up to something, much bigger. I think that's really important. So thank you for that.
Thank you. All right. Well, thank you for joining me today. It was a great pleasure to meet you. It's so nice to be able to connect with doctors across the country that we may have been able to meet people we might not have normally been able to meet. So thank you.
Right. That's right. I feel really inspired by our talk today, Rae Anne. Thank you so
Yeah,
much.
it was fun.
Yeah.
Thank you.
Okay. Take care.